As we all left 2020 behind, we thought we'd be leaving the pandemic behind with it. Defeated, just a bad memory. But at Cone Health's dedicated COVID hospital in Greensboro, patients keep coming.
We are seeing record cases, though, on an almost daily basis. That's got to concern you.
Absolutely. It does.
And hospital executive director Ann Councilman doesn't have a list of tested protocols to fight it.
So this one's different.
It is different.
I find myself, when I pull up in my car, praying not to get this virus. I don't think that ever in all my nursing experience, almost 20 years, I've ever sat in my car and prayed that I didn't get something or die from something when I pulled up at the hospital.
As frightening as coming to work in these conditions must be, the team at Cone Health knows it is the patients for whom the situation is truly dire.
But there's nothing scarier than feeling like you're suffocating.
Correct. And you see their eyes are wide, they're scared. And we're telling them, you know, we're gonna be right here with you. We're gonna work with you, and yeah.
What's caught some healthcare professionals off guard is how quickly the patient's condition can change.
And so that's where these people are becoming what we call happy hypoxics originally. They still look good. You're talking to them, you think they're okay, and that's when you go in an hour later and they're in trouble. Their lips are turning blue. They're dusky. They are guppy breathing. That's the air hungry, where they're trying to suck in the air and can't. And you see the fear in their eyes.
And it's up to nurses like Marisa Cullen to be their reassurance.
It must feel, from your point of view, like a tidal wave.
Absolutely.
Their momentary family.
I had this 80-year-old man, and every time I went into the room, he kept on asking me, am I gonna die? Am I gonna die? And I would hold his hand and I would say, no, I think you're going to be okay. But I think deep down, I didn't know that he was going to be okay.
And those cases aren't isolated.
There are a lot. We tell them we're going to do everything we can. Sorry.
No, you don't need to apologize.
One particular day, the patient was doing okay at first, and then we were at that point that his heart was changing. And we had to call his wife, and we put him on FaceTime. And she thought that we needed to take the ventilator to use for somebody else. We said, that's not. We have enough ventilators. You're okay. We didn't win this fight. And she yelled at us for a while. She wanted to see everything that we were doing. Try. We did. And then she understood, and she thanked us. But that was probably the toughest.
Well, speaking of Cone Health, tomorrow employees will start giving coronavirus shots to those 75 and older. This will happen at the hospital's Green Valley campus. You must have an appointment before showing up. You can visit Cone Health's website or call 336-890-1188. Again, 336-890-1188. Keep in mind, you don't have to be a resident in Guilford County to receive the vaccine there.
Well,